And I'm joined now in the studio by Danny Mortimer, who's Chief Executive of NHS Employers. Thank you very much for coming along. The Home Office is saying that around a third of available visas already go to the NHS. So would you like to see more visas coming your way?
We clearly are having a problem at the moment in that there aren't sufficient visas to allow doctors and other professionals across the economy into the country. What we'd like to see is that those professions that the government have recognised as being in shortage being removed from the migration cap. We recognise absolutely the government wants to set a cap on people who can come into this country, but we also recognise at the same time that the government has said that there are jobs, there are people that are in shortage, and the biggest of those professions that are in shortage is nurses. So we're left with a situation where when we recruit more nurses, which we desperately need, we have fewer work permits available for doctors. The country has fewer work permits available for engineers and scientists and other vital jobs.
Tell us about the direct impacts you're seeing as a result of this.
There's a number of things. I think the first is that there are organisations. We've had an experience, as well as the Manchester experience, where there are at least 400 doctors who've not been able to get into the country in the last 5 months. That means that there are fewer doctors available sometimes in clinic. Patients will have to wait a little bit longer to be treated than we would like, or of course they would like. It means that in order to cover emergency cover in particular, we'll be paying premium pay to agency staff or locum staff. That's money we could be using elsewhere in our services that we're having to pay out as a premium. So these doctors provide vital work in often very small teams right across the country, not just in Manchester, but elsewhere in the country as well. And again, it seems to us the pragmatic solution to count those occupations that are in shortage slightly differently to other jobs. And that would mean there were more permits available for doctors as well as for other people too.
And of course the NHS does have a tradition of recruiting staff from many parts of the world, but even if all the British medical students who qualify as doctors were to remain in the NHS, and we know that not all of them do, even if there wasn't an issue with recruitment for nurses, which we know there is an issue with, even if that wasn't the case, would you still be looking to recruit people from overseas?
So there's two things there. I think the first is the government have made a really welcome investment in expanding medical school places quite significantly in the coming years. It'll just take a long time for us to feel the benefit of those doctors coming into our workforce. So there will be more British doctors in the next 10 years or so. I think the second thing is that, particularly in the scheme within Manchester, we recognise that the NHS in this country can help develop healthcare professionals from other countries as well. The scheme in Manchester is about absolutely us benefiting, but it's also about those doctors bringing back skills and education to their own communities in India.
Now, the doctors who were offered places under the scheme that we mentioned in the introduction and have been refused these visas, can they reapply for visas, or what will happen to that group of 100?
So we absolutely, organisations do reapply, but there's a time limit to that. You can only reapply so many times before you have to start the process again, in effect, and those doctors have to reapply for the jobs and the whole process.
So in the short term, problems, you're saying?
Yes, absolutely.
Okay, Danny Mortimer, Chief Executive of NHS Employers, thank you very much for talking.